Hey everyone, welcome back to the channel. Today I am coming to talk to you guys about a topic that is near and dear and very serious to the work that I do, and that is dealing with children who have been sexually assaulted. If you have just learned about a child who is being sexually assaulted, these are the steps and things to remember and keep in mind. I am Deidre Morgan. I'm a licensed clinical social worker associate and also a child advocate and an early childhood specialist as well. And so these are some things, some tools and steps that you can use if you have noticed, or if you have learned that your child or a child that you interact with in some way, form, or fashion has been sexually assaulted. So number one is so important, is we're just going to jump into it, is to believe them. Believe them when they tell you that something has happened. And that language can look like, I'm so proud of you for telling me this, and right off the bat let them know this is not your fault. Because children, that they need that validation, they need that security to know that you believe what they say and that you're not blaming them. Because a lot of times that first thought is, this is my fault, I made this happen, I am the reason that this happened, I allowed it. And so helping them to come to the conclusion, helping them to understand that it's not your fault, I'm here, I believe you, we're going to work through this together, helps them through the process. Next is to create a safety plan, and that may include removing them from the situation or removing them from the environment. And then also it could be, and making sure that the alleged abuser does not have access to them anymore. And then you can add the language of, you are safe now, I'm here with you. A lot of times, if you, a lot of times, some of the times, not a lot of times, sometimes the abusers are, most of the time, people that they know, right? So making sure that that access is cut off and making sure that you are doing the right thing as far as legal actions are concerned. Which follows into the next one, is to report it immediately. You call law enforcement or you call Child Protective Services. I would suggest both. To make sure that the right actions are taken, because that also lets the child know that this is unacceptable, somebody believes me, and someone is not enabling this harmful behavior from this other person. The next is, don't press them for details. Don't continue to say, well, how did it happen? What did this happen? Whatever. Don't put words in their mouth. A lot of times I just ask, can you talk a little bit more about that? Do you feel like talking more about that? Or you may say, well, do you feel like you want to explain more? But don't press 100% for details. A lot of times, leave that also to the professionals, so therapy services or police, all these people who are going to gather around. Social workers are probably going to be involved as well. These are the people who have done this for years and they have experience with it. So, don't feel like it's your job, I got to pound it out of them, I got to get all the details, and the details may not come right away anyways for them. Next is maintain a routine of normalcy. So your regular bedtime, regular wake up, everything you usually would do, continue to do that, because it creates consistency, and consistency is the breeding ground for trust. So it's like, okay, I know that I can trust and feel good about the fact that I'm going to get up, I'm going to go to school, unless the child is like 100% protesting and not wanting to go. Even if they're younger or old, that goes for all age. This goes for all ages. If they're protesting and just kind of need a minute to gather themselves, which is understandable, allow them that. Give them that space so that they can kind of collect themselves, but still keep a daily routine of wash your face, brush your teeth, wash your body. Still offer food, all those things. Next is to watch for trauma responses, and trauma responses it's different for everybody, but these are some basic trauma responses that have been seen overall. So number one is going to be nightmares or bedwetting. If your child is potty trained, has been potty trained, and has no medical conditions, then you're going to watch for that if they start to begin to wet the bed, or if they begin to urinate like in places that are not normal. So if they're in the classroom and instead of going to the restroom, they're just kind of sitting at their seat and using the restroom, like these are signs. Aggression or withdrawal. They don't want to, they regress because they, aggressiveness. If they're aggressive and withdrawn. So aggressive is because they're angry, right? They're just, it's like so much. They feel like they're out of control. There's no control and they have to do something to gain control. And the withdrawal is because it's like, they don't have the motivation. They're not motivated to do the things they used to do. It could be that they don't want to be seen, draw attention to themselves, because then that could draw someone else to abuse them. There's a plethora of reasons why they could feel like they want to be withdrawn. Sudden fear of particular people or places is another thing, because of course of people that gives you right off the bat that may be the person, or that person may have had some type of knowledge of what's happening. And places could be that it reminds them of the place that they were assaulted, or reminds them of, triggers something in their system that causes them to be fearful of person or that place or an environment, group of people. Lastly is regression in behavior. So if you had a child that was potty trained, they regress, they're not. If you had a child that was walking and is no longer wanting to walk, if you had a child that was making really good strides in behavior, and their older child, and they're all of a sudden are starting to what seems to be angry to you, or want to be locked in their room all the time, or it's just a different behavior than what you guys have been working on, that's a sign that something could have happened. So again, regression is just going backwards. So if you see some backwards movement, then it's time to question yourself, like, did something happen that I should inquire about? Next is validate their feelings. So that is just language. It's okay to feel mad, sad, angry. It's okay. I'm here with you. I'm in the moment with you. I'm not gonna leave you. Like these types of things that will help them to understand, someone is here going through this process with me. They understand. If you have experienced it yourself, take a moment to think about what are some things that I would want someone to say to me, or how would I want to feel, or how did I want to feel when I was placed in that position. And that might help you also give some more language to helping to validate that child. Next is to connect them to professional help. So a therapist, social workers, all these people are people that are going to be able to give them some professional help, a psychologist, a psychiatrist, all of these people, whatever you deem necessary for your child or your family's situation. Next is to be present and to listen, because it's just so much better when you can have someone that has an open ear, or that has a shoulder to lean on or to talk to, and just actively listen, not just listen to respond, but really truly listen to how they feel. And then don't blame. Make sure that the child understands that you do not blame them. It's not about what the child was wearing. It's not about, even the language that the child was using. It's not any pictures or anything that anybody has seen. None of those things matter. What matters really is the situation, is that person was an unsafe person. And so we want to relay that message to the child that none of this was your fault. It doesn't matter about any of the circumstances of where you were or any of that. The main problem is that person was an unsafe person, and they don't deserve to be let loose, to be let off the hook. Like that's them. You don't deserve to be blamed. They do. So these are some of the major things when working with children who have been sexually assaulted, or children who have been raped. Like these are the staple things that you consider and use, but also remember, again, you are a mandated reporter. I'm going to put some links at the bottom of the page as well to help with resources for families who have experienced this situation. If this resonated with you or hit home with you, do me a favor, hit that post notification bell, the like button, subscribe to my channel. I'm going to be posting other resources, and I have some really cool things coming out soon. So stay tuned and stay connected, and until next time, be well, be happy, be whole. Talk to you soon. Love you. Bye.